I begin my remarks by making reference to the WHO Director General, Dr. Tedros, who recently cautioned that we have a long way to go. This virus would be with us for a long time. He added that the world cannot go back to the way things were. There must be a new normal, a world that is healthier, safer, and better prepared. Certainly, we hope and strive for a healthier, safer, and better prepared Virgin Islands in the face of the staggering efforts of this, or effects of this COVID-19 pandemic. As predicted, though not out of the woods, we are faced with pertinent analysis and discussions that could have gone both ways. If the positive cases remained low or remain low, our debate would be, have we gone too far with the curfew measures? If the positive cases were to become high and additional lives are lost, our debate would pivot to, could we have done more to prevent the outbreak? But look around us. We are in this with our neighbors to the west and south of us. We are in this with the region, with North America, South America, Europe, Africa, Asia, the world. Over the past 2 weeks, I have logged into online electronic meetings with WHO, PAHO, and CARFA that were attended by leaders and with ministers of health throughout the world. Meetings with the members of cabinet, meetings with members of the House of Assembly, the government caucus, HEOC team, and we have appeared before you, as we are tonight, with updates. Of this, I am sure, we are in this together. As of 23rd April 2020, the World Health Organization reported 2,544,792 confirmed cases globally, with 175,694 deaths. Of these, and of specific interest to the British Virgin Islands, the numbers in the United States and in the United Kingdom continue to rise. Worldometer reports that as of 23rd April 2020, a total of 744,961 recoveries were also recovered, and this is good news. The Caribbean region has actually recorded 9,877 COVID-19 confirmed cases, with 701 recoveries and 479 deaths. If I could repeat that, the Caribbean region has recorded 9,877 COVID-19 confirmed cases, 1,701 recoveries, and 479 deaths. Of these, and of specific interest to the BVI, the numbers in the Dominican Republic and Puerto Rico also continue to rise. Here in the Virgin Islands, an aggressive contact tracing strategy has been implemented, and it has now resulted in 189 persons currently placed in quarantine and 1 person in isolation at the Dr. D. Orlando Smith Hospital. Since my last update, an additional 9 samples were tested by CARFA. 8 of these samples were negative for the virus that causes COVID-19, and 1 additional positive case was detected. This case also at the Dr. D. Orlando Smith Hospital. This brings the total number of COVID-19 cases detected in the BVI to 6, with 3 recoveries, 1 death, and 2 active cases. 10 additional samples are expected to be transported or were transported to CAFA today for confirmatory testing. We again encourage everyone or anyone experiencing a fever with high cough or difficulty breathing or other respiratory symptoms to call the medical hotline at 852-7650. You can rest assured that your privacy, as dictated by protocols, will remain confidential. A dedicated home visiting team has now been introduced to allow for COVID-19 testing to be done in private homes. This is a new development. The deployment of healthcare workers or contact tracing teams in the community, these persons wearing gears, does not necessarily indicate that a new COVID-19 case has been discovered at that location. I'm going to repeat that only because this is a new development, and anything that is new will bring new excitement. A dedicated home visiting service has been introduced to allow for COVID-19 testings to be done in private homes. The deployment of healthcare workers or contact tracing teams in the community wearing protective gears does not necessarily indicate that a new COVID-19 case has been discovered at that location. As we move forward towards lifting some of the curfew restrictions, an important aspect of our readiness to reclaim some level of normalcy while keeping safe in this new environment is the capacity of our healthcare system to detect, isolate, and treat all active cases. I am pleased to report that the BVI Health Services Authority continue apace to ensure a high level of readiness to meet the new challenges presented by COVID-19. A screening and assessment area has been constructed outside the emergency room with capacity to treat 20 to 30 mild cases per hour, with severe cases being referred into the main emergency room. Medical and surgical wards have been relocated to the 5th floor of the Dr. D. Orlando Smith Hospital, which will allow us to set up a dedicated care unit on the 3rd floor of the hospital to isolate and treat COVID-19 patients requiring hospitalization or isolation. The BVI Health Services Authority has also revisited workflows, guidelines, and protocols in all clinical areas to ensure adequate COVID-19 prevention methods, conducted extensive training in PPEs, and provided for psychosocial support to healthcare workers or frontline workers. Significant investments and donations have been made towards the procurement of a large stock of PPEs and additional ventilators and other medical equipment. The British Virgin Islands Health Services Authority has also set up a dedicated telemedicine service with a call center and the use of new electronic medical record and patient application. This will go well for our accreditation process. An online prescription refill and delivery system is also now available to the entire territory. An advanced triage and An advanced triage and screening facility has also been constructed on the third-floor car park of the Dr. D. Orlando Smith Hospital, and construction drawings have been finalized for the construction of new facilities at the major Peeble wing. These works are being bid and would be in production very shortly. These are but a few of the many initiatives being rolled out on a daily basis across the health sector to ensure that our health system is at its highest attainable state of preparedness to cope with the new demands that it could face in the weeks and months ahead. Our goal, of course, is to need none of the specialized medical equipment, treatment facility, or other resources. This goal is only attainable if we all do our part to protect ourselves from the virus that causes COVID-19. We will continue to strengthen the capacity of the health system to respond to the life-threatening impacts of COVID-19 whenever the need arises. Every sector across the entire territory will also need to make specific and significant adjustment in order to operate safely in this new environment. A multi-agency task force, as you have heard, has been deployed to support and monitor businesses to ensure compliance with public health guidelines and standards. Health and well-being is a shared responsibility across all communities, businesses, faith-based and social organizations, through households, and at the individual level. We must make urgent and serious efforts to adjust to new realities in our everyday lives. This means adhering more closely than ever to physical distancing, hygiene and sanitization measures whenever we go out, as if our lives depend on it. I'll tell you what, because they do. I once again express my sincere appreciation to all the courageous women and men working on the front lines and behind the scenes in this valiant response to this daunting COVID-19 threat. Our healthcare workers, public health professionals, law enforcement, and other emergency services, and the hard-working professionals across public, private, and voluntary sectors. And no, not this time, I will not forget our hard-working staff from the Department of Waste Management with special focus on solid waste, and the teams at the Packwood Pond Landfill and Incinerator. The house-to-house waste collection program is being perfected and is being fully supported by this government. I also wish to thank the people of the Virgin Islands for your sacrifices and your active cooperation with the public health measures that are sometimes difficult to endure, but so vitally necessary for our collective safety, protection, and well-being. We have a long way to go. This virus will be with us for a long time. We are in a better place to deal with the issues that are common to all nations. And as we roll out from 6 to 1, starting on the 27th of April, Monday, we are assured that we will get through this together. By coming together and supporting each other as a resilient Virgin Islands, we will be able to build on our past triumphs, bravely confront our current challenges, and look towards the future with hope and determination. I thank you kindly.